Many Americans will become caregivers at some point in their lives, and the demands of caregiving can become overwhelming and stressful. I'm Grace Trafton of The Better Part. Stay tuned and hear what insights our guests can share with us. Our guest today, Pauline Martinez, is the Education Services Manager of the Alzheimer's Association, Northern California and Northern Nevada chapter. Pauline has a master's degree from San Francisco State University and focused her master's thesis on the physiological effects of stress in caregivers. Welcome, Pauline. So good to see you here today.
Thank you, Grace.
Now, how did you become interested in studying the topic of physical and psychological effects of stress in caregivers?
I started off getting my undergraduate in molecular and cellular biology, and one of my professors gave me a book called Molecules of Emotion by Dr. Candace Pert. And this, to this day, is still one of my favorite books, and it talks about how our thoughts and our emotions influence our physical health through our hormones and our neuropeptides and receptors. I went on from that to get my master's in gerontology with an emphasis in health, wellness, and aging, and was very fortunate to be able to do my internship at UC San Francisco in the health psychology department, together with Dr. Alyssa Epple and Dr. Owen Walkowitz and Dr. Elizabeth Blackburn, who actually won the Nobel Prize for her work with telomeres, studying caregivers. We were specifically studying caregivers who were women aged 60 to 80 who were caring for a loved one with Alzheimer's disease and looking at the physiological and psychological effects of stress on them.
Tell me, what exactly is caregiver stress?
So at the Alzheimer's Association, we talk about 10 symptoms. One of those is denial about the changes occurring in their loved one. Another is anger, both at their loved one that is facing changes throughout the course of the disease, as well as anger that there's no cure, and anger that other people can't understand what they're going through. They also may experience social withdrawal, anxiety about the future, depression, sleeplessness, exhaustion, a lack of concentration, and irritability and moodiness, as well as health problems themselves.
Would it help to start planning for future needs in the earlier stages of the condition?
That's one of our biggest goals at the Alzheimer's Association, is to raise awareness about the differences between normal aging and Alzheimer's, because in the past people didn't really understand. They thought it was normal to start to forget things and experience some of the symptoms of dementia. But we know today that there's a big difference. Many people know a 99-year-old that's perfectly mentally intact and very sharp. What we're trying to get out there is awareness about some of the warning signs of Alzheimer's, and then help people to get an earlier diagnosis. And once they get that early diagnosis, the family can start to put in plans for their health plans, legal matters, financial matters, and then also start to educate themselves on what to expect, both the person with the disease as well as their family members.
Are you referring to clinical depression or feeling down or feeling blue?
Both.
And there's quite a difference between clinical depression and just feeling down and out of sorts, isn't there?
Definitely.
So people can maybe go to their health care providers and get some medication or get some therapy related to clinical depression, is that right?
Yeah.
And what are some of the things that caregivers can do before they get to the total exhaustion stage?
Yeah, it's important to reach out for help. So often we get wrapped up in caring for our loved one because we care so much about them, and we forget to take care of ourselves and reach out for help. One of the best things to do is to call the Alzheimer's Association. We're the largest national voluntary health organization that is providing care and support and supporting research for Alzheimer's. And so we have a 24/7 helpline. If you call
Great.
any time of day, you'll talk to a live person. And we have services in English and Chinese and Spanish, as well as other languages. And it's so important to be able to talk to someone who understands what
Yes.
you're going through. We can also connect them with respite care and other resources like in-home care, also connecting them to adult day services. And we also provide grants for emergency situations. For example, if the caregiver is going through surgery, they may need to place their loved one overnight somewhere for care. And then also at the association, we provide education, which, like I said, is so important. We don't realize, but as caregivers, there's things that we can do to exacerbate our loved ones. And so we can learn about tips for effective communication, how to handle difficult behaviors like wandering or repetitive behaviors. And also, we offer online classes and in-person workshops, as well as have support groups, which is another great way to learn from one another and other people who are going through the same thing.
Now, let's go back to stress and depression. How are they related?
So research has shown that when we go through a very stressful situation, we're likely to experience the onset of major depressive disorder. And once someone has had a depressive episode, they become more sensitive to stress. And so if they experience difficulties in the future, that can trigger ongoing episodes of major depression.
If you're prone to depression, are you also more prone to stress and vice versa?
Definitely. Yeah, so there's something called the autonomy hypothesis that looks at people who have major depression and has shown that they become more sensitive to stress physiologically, and so their hormones start to change, and eventually someone with major depression can actually be launched into an episode for no apparent reason at all.
And what are the physical impacts of stress?
Stress can influence both our endocrine system, our immune system, and our cellular health. It can impact our metabolism, cause impaired memory function, and cardiovascular implications.
And what are the long-term effects of hormonal imbalances caused by stress?
Hormonal imbalances caused by stress can lead to depression, cardiovascular disease, and diabetes and high blood pressure.
And how about stress impacting the immune system?
One of my favorite researchers is Dr. Janice Kiecolt-Glaser, and she actually has been in the field of psychology and psychiatry for quite a while at Ohio State University. And she met her husband, who was Ronald Glaser, and he was an immunologist. And together they started to look at how these fields overlapped. And they are well known for their research with caregivers caring for someone with Alzheimer's. They've been doing this over 20 years. And specifically looking at effects on the immune system, they showed that the immune system in caregivers would age more rapidly, that they had increased inflammation, that they were less able to respond to bacteria and viruses, and when they were given a vaccine, the body didn't mount the response that a normal healthy control would. Also, they showed that they had less control of latent viruses like Epstein-Barr virus or herpes. A caregiver or someone going through a lot of stress is more likely to have ongoing symptoms. And also, what was interesting is they showed that caregivers had slower wound healing. So they actually cut a small hole in the participants in the research study, and they compared the healthy controls versus caregivers, and the caregivers' wound healed more slowly. And these effects were shown even 2 years later after they had stopped caregiving.
Is that right? Is this mostly due to the high stress level?
Yes. The stress can impact our immune system, like I was saying, and change our inflammatory markers and our immune response.
Stress can make us more vulnerable to age-related diseases too, and different kinds of chronic illnesses, it sounds like. Could part of the problem be that some caregivers aren't really taking very good care of themselves? For instance, not getting enough sleep or getting enough exercise, not eating healthy meals, and not attending to their own medical needs.
Yeah, definitely. So often we care so much for the other person that we forget to take care of ourselves. But it's so important to remember that in order to be a better caregiver, we do need to think of our own needs first. When you go on the airplane, they always say, in case of emergency, put the oxygen mask on yourself before you help any of your loved ones. And it's the same way with caregiving. We aren't able to care for them if we physically are not doing well.
Right. And I think lots of caregivers forget that, don't they? And then they don't take care of themselves, and that's part of the problem.
Yeah, it's almost against your first nature. It's like in the plane crash, if you had your child next to you, you want to help them, but so we have to change our thinking about that.
Why do researchers frequently study caregivers to see the effects of stress?
Yeah, they definitely tend to recruit caregivers because caregivers are going through a lot of stress, and historically in the studies they continue to see that the physiological markers for stress are higher in caregivers than in other populations.
What are some of the factors that increase stress in caregivers?
Yeah, there's about 6 different factors to think about. Number one is what is the person that you're caring for able or not able to do? Do you need to help them with bathing, with toileting, with getting dressed, with paying their bills or cleaning their home or cooking? The more help that they need, the more taxing that is for the caregiver. Also, some of the characteristics of the caregiver themselves. When we're older, we're more sensitive to stress. Women are actually more sensitive than men. And especially if we have another job outside of caregiving, or if we have children at home, that would increase the stress level. Also, we want to think about the relationship between the caregiver and the care recipient. Do they get along? Do they live together? Is this a 24/7 job? Is there other people that are helping? Also, we think that having more family members would be helpful because you could split up the roles, but oftentimes it's the opposite. It's actually causes conflict among family members in making decisions. There might be unmet expectations or unpleasant interactions.
Sometimes we think, though, that it might be helpful if some of the duties are split up, such as one person can be responsible for, taking care of all the bills. Another person can do the grocery shopping. But are you saying that sometimes this is not helpful because other family members aren't willing to contribute?
Correct. Yeah, definitely. And also making difficult decisions is another factor that I forgot to mention. The primary caregiver often has to make decisions about which physicians to see, different legal and financial plans to put in place. And again, when other family members disagree with that person's decisions, that makes it even more stressful.
So what can we do if we have family members that are not willing to help or are creating even additional conflict?
Get a family meeting, and if amongst each other you're still having a difficult time, you could call in a mediator.
It's really good to ask for help, though, right? Because if you take on this role all by yourself, it can become very overwhelming very quickly. Hopefully family members are going to be cooperative, but there are other resources if that doesn't happen.
And you can definitely call our helpline. Like I mentioned before, we get these kinds of situations all the time, so we can help coach you through some different strategies for approaching that conflict.
Tell me, what role does resilience play on the impact of stress?
Yeah, resilience is the characteristic that allows someone to minimize the emotional, psychological, and physiological effects of stress.
How can caregivers build up their own resilience?
There's a number of things that we can do. Like I shared before, I highly recommend reaching out to the Alzheimer's Association. We can provide respite care, so giving you a day off. Adult day services could give you 1 day or 2 days off a week to yourself, or 5 days if you're working. Also getting in-home care, or if you need financial help, we can provide grants for that as well. Also, getting informational support as a caregiver, reading up on or going to classes or watching online classes about how to best communicate with your loved one and what resources are available in the community. Also, socio-emotional support is really important, and that's why I can't say enough about support groups.
Right.
Connecting with other people who've gone through what you've gone through, and they can share strategies, because sometimes it's not a straight answer. You need to
Right, exactly.
try different things.
Exactly. There's also online support groups, aren't there?
Yeah. Yeah, we can be, like I said, some caregivers are working and they have kids, so we don't have time to make it out to a weekly support group, but we have an online message board for caregivers on our website.
On your website. Oh, that's great. Because that way you can actually speak with people all over the world and share experiences and really learn from other people's experiences.
Yeah, and we try to connect people that are going through similar situations. So we have specific message boards online and in-person caregiver support groups for LGBT issues, for certain ethnic groups, for the person with Alzheimer's themselves, or people caring for someone that's in early, middle, or late stage, for wives or husbands. So they're all specific.
That's wonderful. Do you know how many people take advantage of your services, such as that?
Well, we're a national organization, so I don't know the figure, but it's pretty large.
But it's pretty widespread.
Yeah, but not as much as we would hope. And another
Really?
thing that factors into that is actually half of people with Alzheimer's will never get a diagnosis. And so a lot of people don't even know to reach out for help, and that's really where the education comes in, because people think that this is just normal aging, and they don't realize that there are resources available to help them.
What else can a caregiver do to prevent or relieve stress?
Definitely things on their own, like taking care of their physical health by exercising is a really great way to mitigate the physiological effects of stress. Eating a healthy diet, making sure you're getting enough sleep, and stress reduction interventions like prayer or journaling or meditation or stretching. My colleague talks about doing 3 things for yourself each day as a caregiver. And these could be something as small as eating a piece of dark chocolate, or listening to your favorite song, or singing along, or maybe lighting a scented candle, or getting a massage. So it's really important to maybe think about 3 things each day that you can do just for yourself.
Tell us a little bit more about your webinars.
Yeah, so we have a number of different webinars. We have live webinars or recorded ones. Right now I just worked on a series. One was on compassionate communication, how to connect with your loved one who has Alzheimer's. Another one was how to bring up difficult conversations with your family member who's experiencing memory loss. When is it time to take away the keys or get them to the doctor if they're refusing? How do you have those kinds of conversations?
What do you say to the family member?
This is a situation where there's not really a black and white answer to that. We come up with a couple different strategies. When it comes to seeing the doctor, you could have an outsider recommend that. You could have the doctor call you to set up the appointment. Sometimes lying isn't a bad thing, but if you're doing something with positive intentions, so you could say, let's go get ice cream, and then on the way back say, oh, look at this, we're swinging by the doctor, we can stop here. So sometimes you do have to kind of deceive them a little bit to get them through the door, so eventually you can get the help that you need. There's treatments available that can help with some of the symptoms of Alzheimer's, and those are other resources you might want to get through your physician.
Right, right. And the medications for Alzheimer's actually is more effective in the earlier stages. Is that right?
No, I wouldn't say that. So right now there's only 2 major classes of treatments that they're using with people with Alzheimer's. And these actually, they don't slow the physiological changes, but they'll help with the symptoms in about 50% of people. So they're okay, but they can help people potentially in the early, middle, or even late stages.
Oh, is that right?
Yeah, but they only help for about 1 year to 2 years maximum.
So not for an extended period of time.
Not yet, unfortunately, and that's why we're working so hard to raise funds for research and encouraging people to participate in research trials as well, because that's a second barrier to research, is
Right.
they don't have the people in the studies. And even nationally, the funds for Alzheimer's research are so low compared to things like breast cancer, prostate cancer, HIV, and so we're really advocating to increase the federal funding for Alzheimer's research as well.
Why do you think there's this discrepancy for funding?
I think as a culture, we're afraid to think about aging. We're a culture that values youth, and so that's one factor. Also, people with Alzheimer's, they can't speak up for themselves, whereas someone with breast cancer could. And so these days, people are getting an earlier diagnosis, and so they are able to advocate for themselves, and I think that's helping a little bit. And then also fear. Alzheimer's is one of the most feared diseases.
Let's get back to the issue of caregivers. I know that some caregivers think that they can take care of everything all by themselves, and that's kind of a trap that they fall into. As time goes on, I think they become overwhelmed with the issues of caregiving. What advice can you give to these people who think, oh, I can do it all?
Mm-hmm. Yeah, I mean, you said it yourself, they need to reach out for help. So many times this has a cultural component too. In certain cultures, there's a big value of filial piety, or the child taking care of their elderly parent.
That's true.
And so that's a wonderful value, but also you can't let it get in the way of taking care of yourself, like I was saying earlier. No one can do this on their own. They need to have help from other family members, from their church, from their neighbors, or and from professionals, and
Right.
from other people who've gone through the same thing. So there's many different resources, like in-home care or the adult day services.
Right, right. So it's a matter of reaching out to all these other avenues of support.
And I know it can be overwhelming, and that's why I do recommend calling our 24/7 helpline, so that we can tell you about the resources and we can listen to your specific situation and help you to think through some ideas for troubleshooting and some potential changes that you could make to support you.
Now, these the helplines that you have, are they staffed by employees of your organization, or are they staffed by volunteers?
Both.
Both.
Yeah. So if you call us 8:30 to 5 Monday through Friday, it'll go to our headquarters office, and usually a volunteer will pick up the phone first, and then if it becomes something too challenging for them, then it goes to one of our family care specialists, who are LCSWs or masters in gerontology, and they can really go more in depth. And then if you call after hours, after 5 p.m., it'll go to our national office in Chicago.
Oh.
And those are live people as well. We have a large
see.
staff there that are also LCSWs and very trained in this specific field. And so even if your loved one's not going to sleep, it's 2 in the morning and you've tried everything, you can give us a call.
Oh, that's wonderful that you have this service. So what kind of training do you give to the volunteers?
They get a very in-depth training, going through our online resource database, and also having someone sit next to them and go through the calls with them.
So that they get pretty extensive training.
Oh yeah, I think it takes a little over a month, coming in regularly to really get trained on the helpline. And usually the people who volunteer have some kind of background in this field, and so they're not coming just in cold turkey.
That's good.
Yeah.
Because that would be a difficult job to come into cold turkey.
Yeah, we want people who can relate to the person
Right.
calling and share experiences.
So you have quite a number of volunteers, and I would assume.
We have a lot of volunteers. We're so grateful for their support, because all the services we provide are free, and almost all of them. And so almost all of our funds we fundraise. And so we have volunteers that help us with our walk to end Alzheimer's. We have volunteers that help with our Memories in the Making art program. I coordinate a team of volunteers that do speaking engagements, and we have the helpline volunteers and more.
And I assume that you do have helpline in different languages?
Yes. Yeah, so in our office, for example, we have Spanish speaking and Cantonese and Mandarin speaking staff.
Great.
And then also our national office has even more language capabilities like Vietnamese, Tagalog, Russian, you name it.
That's wonderful. So you're providing a wonderful service to caregivers and to the patients themselves. Well, Pauline, thank you so much for being with us today.
Thank you for having me.
You've given us some very invaluable information. Thank you again.
Thanks so much.
Thank you for being with us today. I hope you found our program informative. And remember to watch our programs on YouTube and Roku. See you again next week on The Better Part.
Being a full-time caregiver can become very stressful. You often put so much time into caring for the other person that you neglect your own physical and emotional health. This may also create feelings of guilt when you do not care for yourself. If you have caregiver burnout, you may withdraw from other family members. You may have a change in sleeping habits or trouble with getting to sleep. You may also exhibit signs of depression, including the loss of interest in previously enjoyed hobbies. This is caused by extreme stress. 10 symptoms of caregiver stress include denial, anger, social withdrawal, anxiety, depression, exhaustion, sleeplessness, irritability, lack of concentration, and health problems. Know that resources are out there to help you. Services including adult daycare programs, in-home care assistance, visiting nurses, and meal delivery are available to help you manage daily tasks. The Alzheimer's Association, for example, has a 24/7 helpline, which is a great resource for reassurance and comfort to help talk your feelings out. Get educated. You will need different skill sets to better understand and cope with the personality changes and behaviors that come with Alzheimer's. You need to take breaks. Get other friends and family members to participate in the caregiving. You also need to take time for yourself. Physical activity in any form will improve your overall well-being. Watch your diet and get plenty of rest. Taking care of yourself will make you a better caregiver and help avoid caregiver burnout when taking care of a loved one with Alzheimer's.